morning. Thank you for the opportunity to present today. My name is Anthony Carden. Our title is Low Socioeconomic Status is Associated with Lower Weight Loss Outcomes 10 Years After Roux-en-Y Gastric Bypass. We have no disclosures. Obesity in U.S. veterans is a significant health concern. Of 9 million veterans receiving care at the VA, 2/3 are overweight or obese. Poverty levels are also increasing in these U.S. veterans. However, the impact of socioeconomic status on long-term bariatric surgical outcomes is unknown. Our aim of this study is to determine the impact of socioeconomic status on long-term weight loss after Roux-en-Y gastric bypass. Our hypothesis was that socioeconomic status would correlate with postoperative weight loss in the veteran population. This study was IRB approved. We performed a retrospective review of a prospective database. We looked at all patients who underwent Roux-en-Y gastric bypass at a single Veterans Affairs hospital. We excluded any patients that did not have complete 10-year follow-up data. We recorded the zip code of each patient at the time of surgery and used public U.S. Census data to determine the median income in their hometowns. We also used this information to determine the distance of their hometown to the hospital. The primary outcome we looked at was percent excess body mass index loss at 10 years after surgery. We divided our subjects into quartiles by their median income. And we performed a multivariate generalized linear model to assess the relationships between patient characteristics and their percent excess BMI loss. The primary independent variable we used was the income quartile, and we compared all quartiles to the reference of the lowest income quartile. We adjusted the model for age, race, sex, and distance to the VA. 83 patients met our criteria. Of these, roughly 80% were male, an interesting part about our VA population. They were 51 years old. They lived a median of 68 miles from the hospital with an interquartile range from 57 to 387 miles. And the overall 10-year excess weight loss was 58%. Our income quartiles were divided as follows. The lowest income 20 patients ranged from $25,000 to $40,000. The low to mid group had 21 patients between $40,000 and $50,000. The mid to high income group had 21 patients also, ranging from $51,000 to $69,000. And the high income group had another 21 patients, ranging from $69,000 to $128,000. So our overall range of incomes was $25,000 to $128,000. Looking a little bit at our results, between the income groups, sex did not show a significant difference. Race did show a significant difference, and this is evident in our high income group that had fewer non-white patients. Age was also not statistically significant. We did find that the distance to the VA had a significant difference with a p-value of 0.03. This can once again be seen when you look at our high-income group. They lived much closer to the hospital, whereas the other three were around 90 miles away, the other three groups. And with this univariate model that we started with, our 10-year excess body mass index loss did not reach statistical significance. This chart looks at our multivariable analysis. The x-axis has our income quartiles, and the y-axis as the mean excess BMI loss. So we compared each of these to the low-income group, where at 10 years they lost 41% of their excess body mass. And when we compare the low to mid group with that, they lost about 18% more of their excess body mass index, and that had a p-value of 0.03. Once again, comparing to that reference, our mid to high-income group had a 22% more weight loss, and that was also significant with a p-value of 0.01. Our high-income group gained lost about 12% more weight, than the reference as well, this was not significant with a p-value of 0.18. The beginning of this chart reiterates that the low to mid and mid to high groups did not have had significantly more weight loss than the low group, whereas the high was not significant. Gender, ethnicity, and age all did not reach significance in this model. But is this just a reflection of distance from the bariatric center? This is a thought that had crossed our minds. And when we looked at distance to the VA, the p-value was also not significant. So distance was not a significant predictor of the postoperative weight loss. So overall, patients in the low socioeconomic status group had lower 10-year weight loss. This was independent of distance to the hospital, sex, age, and race. Oops.
So,
Sorry, a couple more things. So low income may be a barrier to long-term post-op weight loss. This cohort may be a group that has unmet needs. Further study is warranted to determine which factors related to low socioeconomic status ultimately affect the weight loss, and also to design interventions to improve these outcomes. Thank you very much. I'd be happy to take any questions.